Now, depending upon the clinical features, we must know that basically we're going to look for the set of signs and symptoms that we're going to observe in the patient. The history is important, and as we moved on, we looked for the fact that what is the particular age group that the patient belongs to. Infants have their own causative factors. The juvenile age group has their own causative factors, and the neonates are grouped separately, and they have their own underlying causes that we're going to look for. The positive points that we're going to focus on in the history. So whatever the cause is, apart from even classifying the epilepsy as either focal or either it can be the generalized epilepsy, depending upon the specific classification of the kind of symptoms, either the jerky movements, the clonicity, the tonicity of the muscles, the partial seizures, the absent seizures. These are the different terminologies that we're going to see and we're going to look for in the patient. Depending upon the particular unique set of symptoms that we're going to observe in the patient, we're going to diagnose what is the particular pathology that the patient is suffering from. Apart from these normal routine epileptic seizures that the patient is, that we usually come across when we have the outpatient departments running as a clinician or a physician, you might come across a lot of syndromic conditions as well. So you must know all of these syndromes that we're going to discuss right over here. First of all, the juvenile myoclonic epilepsy. As we even saw in our case study, that the patient presented with the epileptic seizures at the age of 7. So it's again very important that you look for the fact whether the child has been suffering from a particular age group or not. And then you classify the patient accordingly to the age group. Although Sarah was in almost 27 years of age, and that is basically an adult epileptic seizures that she was having, but she started off having the seizural activity at the age of 7. So she was a child, and that is how basically you classify your patient accordingly. You have juvenile myoclonic epilepsies, then you have the Lennox-Gastot's syndrome. This is usually seen in children, and this can be one of the case. We're going to even go through what are the particular factors, how are we going to look for or label a patient or diagnose a patient to be suffering from this kind of a syndromic activity. We have the mesial temporal lobe epilepsy as seen in the patient in particular cases. So the juvenile myoclonic epilepsy usually starts from the early childhood. So this is the usual syndrome that the patient might be suffering from. Again, it is going to be the myoclonic kind of epileptic seizures. The jerky tonic movements are going to be seen in a particular limb. In both of the limbs, the upper limbs or the lower limbs can be involved in these cases as well. Then we have the Lennox-Gastot's syndrome, in which the patient is going to have the multiple seizure types. The EEG is going to show less than 3 Hz spike and wave discharges, and a variety of other abnormalities are also going to be seen over here. The impaired cognitive function is also coupled up along with this seizural activity. As we already emphasized in our case study of Sarah, who's a 27-year-old female, and over there we saw that this seizural activity is not coupled up with any kind of cognitive impairment. So this is how you're going to look for the associated features as well. Either the patient is suffering from the cognitive impairment or not. You're going to ask or look for the signs in which the patient is disoriented in time, space, and person. Either the patient is suffering from fear and anxiety or not. So these are the particular features that you're going to focus on when you have these patients of seizural activity. The associated symptoms are sometimes very important, and you can even highlight them in your history. The detailed history is going to highlight a lot of features. The physical examination is also going to highlight a lot of features of the seizural activity. Then we have the mesial temporal lobe epilepsy syndrome. So this is an epilepsy syndrome in which particularly the temporal lobe is involved. And obviously, it has its particular signs and symptoms that the patient is going to suffer from, depending upon the ORS activities, the sense of the behavior is going to be also affected in such individuals, and then there are going to be abnormal sensations experienced by the individuals as well.